and welcome to the show.
Good evening, and thank you for inviting the Minister of Health.
All right. Now, Dr. Kamangu, what is the HIV rate in Namibia and the status quo of the virus being spread?
Great. So in Namibia, we estimated to have almost like 220,000 people living with HIV. Then this translates to a prevalence of 11% of adults aged between 15 to 19 years old living with HIV. And the incidence, which is the new infection rate among the general population, all age included, is around 2.9%. And when you look at the age group 15 to 49 years old, the incidence is around 5.9%. So the current status of the Namibia stands at 92% of people living with HIV, they are aware about their HIV status. And among them, 98% are on treatment and 93% are very suppressed. So these are the targets leading the country toward what you call end AIDS by 2030.
All right. Now, given the complexity of combating HIV and AIDS in Namibia, traditional approaches to vaccines development that led to many of the licensed vaccines in use today are either impractical or have failed so far, and the results have been ineffective. Now, what has Namibia done thus far in combating HIV countrywide?
Great, yeah. So the Ministry of Health is doing a lot in combating HIV. The first thing is the HIV testing, which is the entry point in the HIV continuum services. So I alluded that 92% of the Namibian population, those who are living with HIV, they are aware about HIV status. We have a gap of 80%, which is a small gap. So the Ministry of Health now is putting more effort by identifying who are those people living with HIV. So the first things on identify case finding of HIV is what we call the index partner testing.
Partner testing.
So index partner testing meaning what? I'm HIV positive, I tested positive, so I need to report on my partner, share with the provider who are my partners so that they can be tested. And this includes also children, biological children, can be tested also for HIV. By doing that, we identify those are HIV positive without knowing their status. The second one we call HIV recency testing. This is a test we are doing to find out if you got that HIV within 12 months. So it's a new infection in your body. So if it's a new infection, meaning that there's some hotspot where new infections are coming. So we need to map the hotspot in order for us to come up with targeted intervention to go and test the hotspot, identify who are the HIV positive, and put them on treatment. So the third one is what you call a self-testing. Self-testing is any client coming at the facility, we offer the test. It's going to test at home. Once they test, if they are HIV positive, they will come back to the health facilities in order for us to confirm that status HIV test in order to put them on treatment. So this is the first part the Ministry of Health is doing. The second one, so if we are done with testing, those who are testing negative, we wanted them to remain negative until we find the cure. So we are doing what you call combination prevention package. There's voluntary medical circumcision, which provides some support, some protection to male, around 63%. We have what we call PrEP. It's a pre-exposure prophylaxis. We give before someone engages into behavior activity. We have also our condoms, and there are some new concepts that are coming in, which we are now promoting. We call U equals to U, undetectable equals to untransmittable. Meaning what? If my partner is HIV positive, and we put the partner on treatment, and the partner suppress the viral load. So that viral load, once the viral load is suppressed, it cannot share to the other partner who is HIV negative. It's what we call undetectable viral load equal to untransmittable. Then there are other interventions just to support the adolescent, girl, and young women. Dreams, for example, is just to empower them out to remain negative. This is one part. So for those who are HIV positive, the ministry, we are applying what we call treat all. Anyone who is HIV positive, despite the HIV status, the level of the immunity in the body, we put that client or that patient on treatment. Then when you put on treatment, we make sure that we do what we call treatment optimization. So give the effective, safe and effective treatment to them. And nowadays we are talking about dolutegravir, which is the best treatment we are giving, and the majority of patients, more than 90%, are on dolutegravir. Once we give them treatment, we want to make sure that they come back, they don't interrupt. The Ministry of Health is applying what we call differentiated service delivery model. So reaching the patient either in the community or when they are coming to the facility, we give them enough medication for them to take. The last one, there's some other extra support, like the psychosocial support we are offering to adolescents or to children. And also we are looking at integrating mental health into HIV services. So this is a package the ministry is offering currently to combat the HIV/AIDS.
All right. Now, with this package that the ministry is offering, how effective is it?
Yeah, so it's really effective because back in 2014, we're not talking about 92% of people living with HIV, they are aware about the HIV status. We're not talking about 93% of people living with HIV are virally suppressed. So by offering this package, we are almost there.
All right.
To end it.
Okay, now we have African countries such as Zimbabwe and South Africa that have approved the crucial HIV prevention drug. Is Namibia making strides in adopting this this anti-HIV drug?
Great, yeah. So South Africa and Zimbabwe, they are using a new drug we call long-acting injectable, is carbotegravir. So this drug they are using for preventing is part of PrEP. Okay, so we have that drug in our ART guideline, the 2021 ART guideline. Then we are waiting for this drug to be approved in Namibia by the Namibian Medical Regulatory Council, NMRC. But however, we have engaged already with some implementing partners are more interested to support Namibia to bring this long-acting injectable in the country. So we have started already some consultation. And we hope if things goes well, by next year, end of next year, maybe we'll have that drug. And so far, the price is quite high. We need some support. And once the price will be stabilized for every country to afford it, and this one will be fully implemented in Namibia.
All right. Now, if this drug comes into Namibia, we'll obviously have those first people that will do the clinical trial. Are you ready to face the consequences of the effects that come from this?
Great. So Namibia is having a small population. And we have the NMRC, Namibia Medicine Regulatory Council, which allow any drugs to be used in Namibia. So this body is looking at the safety of the drug, the effectiveness of the drugs. So this body has been there to monitor the drugs, is the one preventing Namibia to get drugs which is unsafe to our population. So NMRC allows Namibia to use drugs without going through clinical trials. Then we are not planning to do clinical trials on these drugs. So we'll use it once it's approved by NMRC, and the Ministry of Health always align with the WHO, the World Health Organization recommendation.
All right. Dr. Kamangu, thank you so much for joining us this evening, and I appreciate all the information that you had to give to our viewers this evening.
Thank you.
All right. That was Dr. Jacques Kamangu, who is the Deputy Chief Clinical Mentor in the Ministry of Health and Social Services under the Directorate of Special Programs, talking to us about HIV and AIDS in Namibia, where we stand, and also some of the initiatives and the projects that the ministry is putting up in order to lessen the spread of HIV and AIDS. Don't go anywhere. When we come back, we